Hello everyone and welcome to MedGate Today TV, and we are in Bangalore witnessing the Sterilize and Rise event, an initiative by ASP. And MedGate Today is the media partner, and we are very much proud to witness such a beautiful event which is giving the insights on how the sterilization can lead to the future of healthcare and the patient safety. We have Dr. Ramasubramanian, who is the Infectious Disease Specialist at Apollo Hospitals, India. And he gave a very good presentation on advanced instrumentation and sterilization beyond robotics. Such a good topic which not only talks about the infection control but also talks about the technology which we are adopting in this era. So let's hear some of the insights, what he talked over the podium and what he wants to convey to the world. Hello sir, and thank you so much for coming here.
Thank you very much. Pleasure to be here today. My talk today basically conveyed that there is a lot more happening in the hospital beyond what the patient can see.
Understood.
The patient sees a surgeon, the surgery goes off well, and most often everything happens well, but sometimes things can go wrong. The patient may develop an infection in the surgical wound. The patient who is in the ICU may catch an infection in the hospital. These are what we call as hospital-acquired infections.
Okay.
And the idea is to have protocols and processes in place in the hospital which can help prevent these, so the patient has a smooth stay and recovery in the hospital.
Yeah.
So one such aspect is what we discussed today about sterilization of instruments. When the doctor cuts open the patient, does surgery on him, even though the surgery may be successful, sometimes the patient can end up with complications related to infections which can happen in the wound or even elsewhere. So it is very important to sterilize the instruments properly.
Yes.
We are able to steam sterilize most instruments which can handle steam.
The traditional method.
Yes,
Okay.
yes. But sometimes, or shall I say more often than not, we use a lot of instruments now, the endoscopies, the robotic surgeries, the arms, laparoscopic methods, several things which unfortunately cannot be subject to heat sterilization.
Okay.
Heat sterilization works very well and gets rid of all the bacteria and the spores. But for instruments which we cannot subject to heat sterilization, the simple endoscopy or ERCP, now these instruments are subject to something what we call as high level disinfection, that is using certain chemicals to get rid of the bacteria. But since the instruments are long, they have narrow lumens, they have crevices which are very difficult to get in, the first process is to ensure that they are cleaned thoroughly before they are subject to any form of sterilization or disinfection. And subsequently, as I said, because high-level disinfection may not work always, we need to now resort to newer techniques. The plasma sterilization chamber, what is called the steroid, is a very useful instrument in sterilizing these so that the patient gets a very smooth recovery and infections can be avoided.
Yes.
A lot of this is because of what is called biofilm, which is a slime layer which forms because of organic material, debris and blood in the instrument. So thorough cleaning has to be done, followed by some sort of sterilization. As I said, steroid is a very useful option to prevent, infections when using instruments which cannot be subject to heat sterilization.
Yes. So as you are the specialist into this, so how do you see the next decades coming into the advancement of sterilization?
See, we are using more and more invasive techniques. It need not be surgeries. It can be outpatient procedures. It can be investigative procedures. So we are using instruments which are becoming more difficult to handle and reprocess. Lot of times we use single-use device. You use on one patient and then throw them away.
Yes.
But in places like India where there are constraints with expenditure, we have to reuse. So the processing of these instruments become a huge challenge.
Yeah.
And we are using more and more of them. Fine instruments where keyhole surgeries, we make small nicks and put it in, or we go through areas or anatomy where you can negotiate small instruments, and getting these ensured that they are safe for the next patient is a huge challenge, and this is going to be a major problem in future. Yeah. So coming up with newer technologies which don't damage the instrument, at the same time is able to clean it well and sterilize it is what we are looking at.
Yes. And we are looking forward how your insights and the technical insights which the companies like ASP and others will be looking forward to, I will say, invented, and we are looking forward to a great patient safety in the future so that everyone will be healthy and best in the healthcare and in the world. Thank you so much, sir, for your insights, and we will be looking forward of your insights in the future as well.
Thank you.